Okay, welcome to those that are joined us from home, as well as anybody that's joined us here in council chambers this evening. Tonight we're going to get a briefing from the York Poquoson Department of Social Services, and both Mr. Richard Varilla has joined us as the Assistant Director, and Kimberly Johnson as also the Assistant Director. So we are all ears.
Okay, thank you so much. I'm Kimberly Irvin, and I appreciate the opportunity to be here. And we just wanted to give you a little bit of an update on some programs. And we sent out an annual report. I believe you got that a few weeks ago. And so we just want to summarize some of the major initiatives that we've had over the last year that we think you might be interested in. I just wanted to point out one thing that's not in the annual report is that we are involved in shelter operations. So we were pretty busy with the last event that we had, and that's a service that we enjoy providing for the community and its citizens. But I'm going to turn it over now to Rick Varilla, the Assistant Director, who's going to talk about service programs in his division.
Thank you, and I also want to echo Kimberly in that we're delighted to be here, and thank you for having us. I'm going to talk about a program that we call Fostering Futures, and this was very exciting to us. This law went into effect in July, and for a long time, we have been trying to get legislation and authorization to extend services for foster kids beyond the age of 18. Because, often they'll age out of foster care at 18 and they're on their own. And I'm sure most of you were like me, definitely not ready to go out in the world when I was 18 years old. In fact, I don't know if I was ready when I was 30, but, these kids would... we'd kind of turn them loose and then worry about them. So the General Assembly passed the Fostering Futures law, which allows us to continue supporting these kids and providing services to them up until the age of 21. And we offer housing support. In other words, we can give them a stipend to help them pay for room and board, whether they're on their own or whether they're in college, for example. We can pay their room and board for college. Or some kids, if they're developmentally delayed, we will get them in a structured independent living program. And, it could be a setup where they have an apartment or a suite that they share, and then there's full-time counselors that work with them on some really basic skills, grocery shopping and paying bills, paying monthly bills, help them get jobs, and help them cope with the various conflicts that we all have day to day. We can help with their education. We can help with tuition payments, or if they're in a vocational school, we can help with that. And in order to be eligible, a young person must either be in a secondary education or a program leading to an educational equivalent, a GED program, for example, or still in high school. They can be enrolled in an institution which provides post-secondary education. That would be a college or a vocation or a trade school. They could attend classes to promote or remove barriers, for example, Job Corps. Or if they're not in any learning program, they can be employed. And the rule is they have to be employed at least 80 hours per month. If because of limitations they're incapable of doing that, we can still support them with a documented medical condition. Now, in order to be in the program, the young adult is no longer a child. They've reached the age of 18, so it has to be an agreement. And so we have the Voluntary Continuing Services and Support Agreement, which has to be approved by the court. So we go before the judge, the provisions of the agreement are presented for the court, whether it be the youth is working or in a education program, and it spells out what services we are going to provide, what we expect from the youth, and then the court would approve that plan. And so the plan is in effect. There are processes for terminating the plan, and in some instances, we would have to go back to the court, but the agreement is sealed by the court. And so we have a variety of placements. Some kids are on their own. If they're married, they can be with their spouse or live in a college dormitory, and the rest of the list is on your PowerPoint. However, there are some placements that aren't permitted. They can't live in a group home or a residential facility. If they're active in the military, we figure that the military will take care of them. They don't need us to take care of them. They're in good hands with Uncle Sam. And of course, if they're incarcerated, we would not support them. Now, we can't support them when they come out of jail. But what we do is we can make the payments directly to the youth, and typically the base amount is about $700 a month, is what the base amount is. If the youth has special needs, we can have a enhanced maintenance amount, and if they are in a supervised independent living program, we can take care of that for them. So with all that, again, I have to say that we're thrilled. We have three kids, I call them kids. I mean, we've been seeing them grow up. They're young adults. And one of them is a Poquoson young adult. She's doing great. She's living in Richmond, and she's working. She's fulfilling her hours, and I believe fall semester is her first semester in community college. So this kid is doing great, and we're really proud of her, as well as the other two kids that we have in the program. So, and now I will turn it over to Joe Johnson.
All right. I'll try to, am I speaking into it loudly enough?
Yes.
Okay.
Thanks.
Again, I'm Joe Johnson. I'm also one of the assistant directors. I have oversight of the benefit programs. And I'm going to speak to you tonight just a short time on the Medicaid expansion program that's coming up in Virginia. That's a hot topic on our side of the house right now. It is called the New Health Coverage for Virginia Adults. That's a mouthful, but that's what the state has decided on for the title of it. The coverage does begin January 1st for these new individuals that will then be eligible for Medicaid with the expanded benefits. It's estimated that about 400,000 people in Virginia that currently are not eligible will become eligible. Our estimate for Poquoson is 200. We have 1,100 in York County and 200 Poquoson residents that they're estimating that will meet the criteria that aren't currently eligible, but with this new eligibility criteria will meet the criteria to be eligible for Medicaid coverage. It'll cover people in occupations that don't typically offer health insurance, which are mostly your part-time positions. Now working 30 hours a week is a big deal in a lot of places now, particularly some of these that are listed there in your PowerPoint, retail, waitressing, construction jobs. A lot of those jobs don't currently offer health insurance. And those people, if they fall under the income guidelines, will become eligible to receive Medicaid coverage.
Not an age requirement.
The next slide talks about that.
Oh, I'm sorry.
That's all right. Good lead in for me. The new covered group is for adults that are between the age of 19 and 64. Currently, children under 19 are eligible, and people 65 and older already meet a covered group. So this would be for for people between those ages, 19 and 64, who do not receive Medicare benefits. The income limit is 138% of the poverty limit, so that's really their three criteria. Is their income would have to be under 138 of the poverty limit for their size household. They have to be between the ages of 19 and 64 and not receiving Medicare. And if you meet those three criteria, you would be eligible for the Medicaid coverage effective January 1st. The chart shows you some of the differences between who is currently eligible and then who will become eligible. There's no change to children under 19 and pregnant women. They will stay the same. Their income limit's actually already higher than this new covered group. People, it says disabled, but also over 65. Currently, their income limit is only 80% of the poverty level, so it will go up to 138%. For people that, parents of children under 18, their income level is currently very low. It's only 52% of the poverty level for a household of 3, and it also will go up to 138%. And then childless adults, people between 19 and 64 who do not have dependent children under 19 living with them, are not currently eligible at all, and they will become eligible as long as their income is under 138% of the poverty limit. The next slide just gives you some of the services that Medicaid pays for, and it's pretty much just like our health insurance. It pays for pretty much the same things. Both preventative and emergency services, has all those things that it covers. It also covers mental health. And the people that are eligible for Medicaid are put into HMOs, which the next slide talks about that. When they're first enrolled, they're just in what's called fee-for-service, where they just are strictly just Medicaid. They can go to any doctor that accepts Medicaid. Within about 2 months, it's usually about 60 days after they are enrolled, they are put into an HMO. The choices that are for Poquoson residents are Optima or Health Keepers. They're given information and it tells them what they cover, and then they choose which one they would prefer to be enrolled in. If they don't choose, they are assigned one, but people are given the option to choose the HMO that they would be enrolled in. And there are two types of HMOs that started in August with something called Commonwealth Coordinated Care. That's for people with chronic illnesses, have a lot of health problems, where they offer even more services to try to ensure that it's not duplication of maybe prescriptions that some doctors, like one doctor might be prescribing one prescription that another doctor, they might be going to another doctor that could be prescribing other things. It's much more managed care. And then Medallion 4.0 is just the, if you will, the normal HMO, that the Optima or the Health Keepers. And the next slides just give you information. If you're interested in looking up more information about the program, it gives you the websites to do that. The only other thing I have learned just last week, actually, is the state is trying to help us get this glut of new applications that everybody expects to receive processed. The application period actually starts November 1st. People can start applying even though they would not be, the coverage wouldn't begin until January 1st. So there's a limited coverage of Medicaid now that just offers family planning services whose income limit is around 138%, and they're automatically moving those people over into this full coverage Medicaid group for us. And that's what I just got yesterday in Poquoson, that's 50 people that will just automatically get full coverage Medicaid. Then for our SNAP clients, food stamps, if you will, now it's Supplemental Nutrition Assistance Program. Those people and the parents of children who currently receive Medicaid are the state's calling them invitations to apply for Medicaid for themselves. It's 3 questions that they answer, one of which is, do you want, or would you like to have medical coverage for yourself? Has your income changed since you filed your application? And one more question about if they have specific health needs. And if they get those back in, we can just put them we just have to go into the computer system, answer those 3 questions, and then the state will do runs each month and pick those people up to automatically enroll those for us as well. And the numbers of those for the SNAP cases is 24, and for parents of children is 55. So if my quick math this afternoon just before I came was correct, that's 129 people. So out of the 200 estimated people that would be eligible, more than half will be pretty easily enrolled into the program for us, which I'm really happy for. And my staff will be as well. Any questions?
Questions, council?
I just have a general question. You had
Sure.
Incarcerated adults as one of the classes that would get this. I thought that the state took care of the incarcerated people as it is.
That's one of the things that's changing with this, as part of this new Medicaid. Now what we can do with people that are incarcerated, they can apply for Medicaid, and if they are eligible, they have a particular, we call them aid categories. There's a particular aid category that they're coded in the computer system so that if they have a serious illness, that they're actually an inpatient in a hospital, then Medicaid will pay. Just for routine services, and then I can't think what it's called, the jails, or still do provide their medical coverage, Department of Corrections. But for inpatient care, Medicaid, the money can come from Medicaid instead of from Department of Corrections.
I do have a question about the Poquoson Futures program.
Okay.
Where it says a person can be enrolled in an institution, okay? Are there any measures put in place to prevent fraud in that, where someone could just go in and enroll and then never attend classes but still get the money?
Yeah, the other thing, and I should have mentioned this, is we also provide case management. In other words, the case is still assigned to the social worker, if you will. So we don't close the case, and the social worker is required to make monthly visits with the young adult. So part of that case management process is to make sure that the youth is still in compliance with the program. So yeah, we're checking grades and making sure they aren't cutting classes and doing things like that.
Any other questions? Well, let me just say this. I'm impressed by your grasp of these new programs, and the one thing that really hits home with me is how much more work it is for your office. Okay, so new programs doesn't necessarily mean new staff. All right, and what the message to you is, we appreciate what you do for the city of Poquoson, also for the county of York. Really appreciate and always have the fact that you are an institution that looks out for all. And one of the things that I've always been impressed about is the way that you look out for the mental health of our citizens. So really appreciate what you do, and let us know what we can do to help in that office. Okay? But really appreciate this, really appreciate the brief, and thank you for what you do.
Thank you. We appreciate your support, as always.
Okay, thanks. So we'll wrap this up and go to our regular session.